Hi everyone! Today's skills video is on how to change a central line dressing. Let's get started! Before starting, I am going to hand sanitize. Supplies you are going to be needing is clean gloves, extra masks for the patient, and a central line dressing kit. Here is a closer look on what the central line dressing kit looks like. I will now put a mask on the patient. Because this is a sterile skill, I don't want the patient to breathe directly onto the central line site and possibly introduce pathogens into the site. Make sure to turn the patient's head away from the insertion site and educate them to stay still for the rest of the dressing change. So this is what the Statlock looks like. In a separate packaging, it is not sterile, so make sure to change the Statlock prior to the dressing change using clean technique. That way my new Statlock can stabilize my central line while I'm changing the dressing. Tear open the packaging. Inside is a skin prep wipe, anchor pad, and the Statlock device itself. So, how to put it on is the wings of the central line will fit into the inside movable stick, and then you close the outside door flap and click it into place. That will lock and stabilize the central line. Here's an example of what a finished central line dressing looks like with the Statlock. I am going to grab some tape and tape down my line to make sure it doesn't accidentally get pulled and dislodge while I am cleaning the site. Once that is done, I am going to carefully peel off my old central line dressing. Don't be alarmed, the central line insertion hole is actually not that big. It is actually very small, kind of similar to the tiny hole on the right, but for the purpose of this video, we would just pretend that the hole is actually smaller and it is where the line is exiting. Make sure to look at the site around the line for any signs of infections like discharge, redness, skin breakdown, or any bleeding. I will now tear open my dressing kit. Remember, the inside of the kit is sterile, so I am going to grab the mask from the top and put it on myself. Then, grab the sterile gloves and open it away from my kit, but still keeping my dressing kit within my line of vision. Take off my clean gloves and put my sterile gloves on. There is a separate video I made on how to put sterile gloves, which I will attach the link at the bottom in the description box, so please make sure to check it out. I am going to grab the Chloraprep, squeeze the handle till I hear a click, which will release the chlorhexidine solution and saturate the sponge. Wipe the insertion site with an in to out circular motion. This makes sure that I don't introduce new pathogen back into the site. Then scrub the skin around your lines and the cap itself too. Dispose the Chloraprep into the trash can below me, still keeping my gloves above my waist. Tear open the alcohol swab sticks packaging. Clean the insertion site with the same in and out circular motion. I repeat that 3 times with 3 separate cotton swabs each time. Then wipe the surrounding skin with the skin prep to prep the skin for the dressing. Let that dry. Then I grab the BIOPATCH, which is a tiny disc with an antimicrobial solution in it. Put it directly on the insertion site with the blue side facing up. Grab the TEGADERM dressing Peel off the covering to expose the sticky side. Stick it on top, pressing down, making sure the BIOPATCH is in the center. Remove the side coverings. I am now removing my sterile gloves and putting on clean gloves. Grab a pressure cap, tear open the packaging, expose the Statlock side, and replace the old cap with the new. I am going to flush the line to ensure patency. Grab a flush, remove air in the syringe, connect the syringe, pull back the plunger to verify blood return, then flush. Disconnect and apply Curos cap onto the end of the pressure cap. Make sure to date, time, initial your dressing. Depending on your institution policy, but typically central line dressing is changed every 7 days with the BIOPATCH, every 2 days for dressing without BIOPATCH, or earlier if dressing is soiled or loose. Remove my mask and the patient's mask. Let the patient know that you are done with the dressing change and educate them on the signs of air embolism and to notify you immediately if he or she experience the symptoms. Thank you so much for watching. Like and subscribe for more videos. Bye!